experience, where is dementia care, falling short today, especially in primary care settings? And then why is primary care such an important place to improve detection and management?
So these are great questions. To begin with, for many older adults, primary care is the only healthcare contact that they have. So it's the only place where a problem can be recognized and addressed and referred on to appropriate specialists if that is needed. Primary care often recognizes cognitive disorders late. And when we recognize it later, there's less time to intervene in a helpful way. Time is, the neurologists often say time is brain. The disease is progressing. And if we can recognize and intervene early, that's much better. We can counsel the family, we can counsel the patient, we can begin medication, and we can, most importantly, deal with support system and medical factors that would otherwise make the condition worse. So primary care is where early signals of neurocognitive disorder can be detected. Things like self-neglect, grooming problems, missed medications, poor sleep or appetite, weight loss, problems paying bills or keeping the house clean, worry that a caregiver has about how somebody's doing, subtle changes in function and ability to care for oneself. These are where we want to intervene and build a support system before it becomes a crisis. So what primary care is in a position to do is early detection and planning for future care. Now, I'll add to this a very important observation that was published in a recent study that showed that an estimated 90% of people with mild cognitive impairment go undetected in primary care. So there's a lot of room for improvement.
Can you just tell me why IBX is launching this dementia care initiative now and what motivated the partnership with Jefferson Health?
Yeah. So just stepping back in terms of context from our perspective, this is part of our clinical care innovation program. We really launched this in 2020 as the leading health plan in the southeastern Pennsylvania. And again, we're mission driven. Our mission is really to improve the health of the communities that we serve. And the clinical care innovation program is a way to invest in our network in a way, right? So with our value-based partners, we have had two components. One is we have a series of grants that we have for new care models to test new approaches to care that are going to be improving quality of care, experience of care, the total cost of care in terms of efficiency, and also improving equity. And we've had those going since 2020. Those are grants where, again, they're sort of like studies, right? And this program and partnership that we did with Dr. Rodrigo and Jefferson is a part of those competitive grants. And the other things that we've done are kind of pilots where, it's changing in care models, but there are things that have been proven elsewhere, and just we need to figure out how to do that with our provider partners. And so it's really kind of trying to catalyze the change that can be so agonizingly slow in healthcare, right? And so that's the concept of the clinical care innovation program. This year, as in the last few years, we had a competitive grant process where we solicited applications from around the network, and this proposal around improving earlier diagnosis of Alzheimer's dementia or mild cognitive impairment was one that really stood out for us. And so we, as independents, are giving a grant to support studying this new care model. And we hope to learn from it and to help catalyze its use at Jefferson. And honestly, to, again, if it's working well, we want to help disseminate it across our network.
Wonderful. Thank you. And I guess what kind of, what drew your attention to the area of dementia? Is that something you guys haven't had a huge focus on, or?
So there's a lot of things that kind of come together to make dementia a really important topic for us. One is that we have been one of the more longstanding Medicare Advantage plans in this region. And part of what that means is that we've had members for a long time. And so our members are aging. And it's not just the 65-year-olds, but we have, 70 and 80-year-olds, right? And so I think, again, you're thinking about what does healthy aging look like is a really important problem for us. And thinking about, also mentation and dementia is one of those components. Part of that has meant that, as the Institute for Healthcare Improvement has had this age-friendly health system initiative, where they've been focusing on the 4Ms, which are things that are going to be important for our members as they age, and that's what matters. Thinking about goals of care, mobility, their medications, right? A lot of our members have a lot of medications. And the fourth one, again, very important, the mind, right? Or mentation, right? And so that is another component. And we have been designated one of the pioneer health systems by IHI in terms of being an age-friendly healthcare plan. And then the other thing that kind of comes into it is this isn't even the first time that we've partnered with Jefferson around dementia care. So in 2022, one of the other grants that we had with Jefferson was around using telehealth and early kind of palliative care involvement to help have some of those goals of care conversations with people with dementia. That was with the PI was Dr. Brooke Worcester at that point, and again, sort of helped to show that it had a positive effect on experience and some of the quality outcomes, and even on avoidable utilization of healthcare, right? So all those ER visits and hospitalizations that you would want to avoid. So we've had some track record of thinking that it's important. We're also really focused on that in terms of our ability to have a really compelling and top tier sort of plan and improve the health of our communities. And dementia is really a kind of cognitive impairment is a part of that. That again, I'm not sure that we've fully figured it out as a country and as a health system, and we want to invest in making it better.